everybody. I'm Katie Kraus-Mork. I'm the CEO of Novolin Fertility. I'm previously an entertainment reporter and an Emmy winner. And I'm so excited today to be joined by Dr. Gary. He is the medical director over at Fertility Cloud. Dr. Gary, thank you so much for lending your time to us today. Let's just start out by you kind of introducing yourself and telling us about your experience and your background.
Hi, thank you so much for the opportunity to come and speak with you today. It's wonderful. My name is Dr. Gary Levy, and I'm a reproductive endocrinologist. I've been in practice for approximately 12 years. I did my fellowship at the National Institute of Health. I've served in the military, and for the last 3 years, I've been the Chief Medical Officer of Fertility Cloud, which is a comprehensive telehealth fertility platform. I also serve as an assistant and then an associate professor at the Uniformed Services University, and then a board examiner. So my practice is very diverse, from clinical practice to surgery to research, and also helping women and couples conceive through telehealth.
How did you first get involved with Fertility Cloud, and what was appealing to you about that? Because like you said, it is quite different from the standard world of fertility.
Well, we saw that the practice of medicine and the field in general was being transformed in multiple ways. And there was a big push towards telehealth, especially with the initiation of the COVID-19 pandemic. So it was a wonderful opportunity for us to capitalize on those things and provide a platform, provide a venue where people who are struggling to conceive are able to do that without leaving their home. And then so our mission was to make reproductive care available and accessible to everyone. And that's how we started Fertility Cloud.
We at Novolin are so excited that we were able to partner with Fertility Cloud. And I want to talk to you about at-home testing, because that's what we do. And I do feel like it goes really hand in hand with the telehealth services that you guys offer. So what do you say to people, I guess, about the advantage of at-home testing, but also to the people who are skeptical of the process and the accuracy in doing it at home and then doing telehealth over the computer?
Sure. Well, anything that's new is going to be a little bit slower for people to adopt comprehensively. But with time, as people get used to it and the novelty wears off and it's proven to be effective, then it's going to become mainstream. And so certainly direct to consumer or at home testing is new, but there's been multiple studies, adequate and very, very good, robust studies demonstrating that it's as effective as going to the lab and doing a venipuncture. And so in my opinion, I think for a population or a plurality of people that is more conducive to receiving their care at home, certainly more convenient. I think it's a great improvement, not necessarily a substitute, but an improvement of what's available out there currently. And so for people who are very busy, people who just don't like going to the doctor, and ultimately everyone in the future, I think this is a great, great improvement at what's currently available.
You mentioned that people are slow to adapt this type of medicine. But then you also said, until we see the proven results, kind of talk about the results that you guys have had at Fertility Cloud thus far.
With regards to uptake, I think the satisfaction of the care that we've delivered and the results that we obtained has been stellar. And I think the amount of reviews available to the general public speaks to our successes with regards to the clinical outcomes, the care delivery, and the patient satisfaction. And so, first of all, we provide unmatched convenience. We provide, I think, excellent empathy with the clinical team that we have. And the fact that we're able to do, for the most part, obviously there's things that in terms of imaging testing and additional testing that we're just at this point is impossible to provide at home. The overall opportunity for the patient to receive their care, I think, is, in my opinion, obviously I'm biased, but superior to the standard model of how reproductive care is delivered currently.
Sure. What does a 30-minute session look like when somebody goes on to Fertility Cloud and books that first consultation? What will a patient walk away with?
So first of all, we want everybody to realize that prior to that happening, there's a team of people that's already invested in ensuring that you're going to have a satisfactory and a successful consultation. Now, we won't be able to help everyone, obviously, because there's some things that are some diagnoses and some cases that certainly require surgical intervention or in vitro fertilization. But the first thing that happens is we always review any kind of medical records that have been forwarded to us, and so we're prepared for the consultation. And the consultation involves a thorough evaluation, a history, specific questions that will allow us to tailor our approach specifically to the individual and optimize their treatment. And so the time is spent basically like any telehealth visit where we try to ascertain what the issue is and then build a plan. A lot of times it requires a follow-up after certain testing, and most of the time it is direct to consumer testing, such as what you're offering as well. And then, but a lot of times we can proceed directly through treatment because one of our tenets is to streamline things as much as possible and to remove any kind of barriers to care. And so what ends up happening in a traditional appointment, there tends to be a delay between the initial visit and then a follow-up visit and then the treatment initiation. What we try to do as much as we can is to maximize your time and then start treatment as soon as possible, because reproductive care tends to be very conducive to telehealth because there's a lot of women, a lot of couples, a lot of people that we can start treatment just by taking a good history and getting some at-home testing.
What is usually the first course of treatment that you
Well,
see?
it certainly depends on the issue, and that's why we personalize everything. So, for example, in women with polycystic ovarian syndrome, for example, who don't ovulate, the initial treatment would be ovulation induction in combination with like optimization of lifestyle. So we're very also big on a comprehensive approach, not just medicine. And
Yeah,
so we talk a lot about ensuring that we optimize lifestyle, healthy eating, exercise habits, certain supplements that are important for the overall health, but also a lot of times make the patient more sensitive to any kind of prescription medication as well.
sure. One of the tests that we offer that I have not seen anywhere else in the at-home test kit market is
Mm-hmm.
your AMH with your vitamin D. And this
Mm-hmm.
was super personal to me because when I first tested my AMH, my vitamin D I was so deficient in it that it actually
Mm-hmm.
made my AMH significantly lower. But
Mm-hmm.
then I supplemented with so much vitamin D that it went up drastically.
Mm-hmm.
Why do you think it's a good idea, in your opinion, to test both things together? Why do
Mm-hmm.
you think it's a good option that we're offering and that you would offer to other patients or recommend them to take?
Well, vitamin D insufficiency or vitamin D deficiency, and it's almost a modern plague with the amount of times that we spent indoors. There's a good percentage of the population that is insufficient or frankly deficient. And so abnormal vitamin D levels unfortunately can mask an abnormal AMH. So there's a false positive rate in a proportion of women who are going to be vitamin D deficient. So it's important for us to interpret the test in the context of your physiology. Now, if there is vitamin D deficiency, we can correct that and then reassess, and that will um, guide our management towards different recommendations. For example, if somebody is a vitamin D deficient and then the AMH recovers, that would certainly be a different recommendation than if the AMH doesn't recover. So
Sure.
it's certainly very, very important to, again, look at the whole physiologic spectrum of where the patient is.
At what age would you recommend women who are interested in conceiving children in either the near or the distant
Mm,
future start testing their fertility
mm,
hormones, including their AMH, their FSH, their estrogen? Uh,
mhm,
I feel like we always hear about the biological clock, which is
mhm.
stressful, but also very real in a lot of ways.
Okay. Well, the textbook answers, those hormones don't necessarily correspond with the ability to have children.
Hmm.
Abnormal values in those hormones correspond with response to fertility medication during treatment. But that being said, the practically speaking, a lot of women are measuring those hormones because they want some sort of information to make decisions about their life. And so the overwhelming answer is age kind of takes priority. And so if someone's interested in starting a family or potentially starting a family in the future, those tests allow for recommendations and counseling in terms of what are the options and what are the best options available. The general rule is starting the process at a younger age is always going to be a little bit better and superior in terms of the results, whether it's spontaneous conception or the probability of having a baby with any kind of fertility preservation procedure. So my recommendation, if anyone's thinking about starting a family, is to seek out a healthcare professional to understand how the process works and what are the best options available to you currently and potentially in the future, and then acting on those recommendations if it's appropriate for the individual.
Sure. What is the biggest message that you wish you could share with all women hoping to conceive one day in terms of just knowledge and awareness in terms
Mm-hmm.
of their body and what's offered out there right now?
Well, and, in my opinion, having children and having a family is, I think, one of the most important things that we do while we're here on this earth. And so it's certainly what's one of the reasons why we started this endeavor is to ensure that it's available and accessible to everyone. And we break down as many barriers as we can for women and couples attempting to do this. I would say that I think the most important thing is be your own advocate. Um, and
So important.
Absolutely. And seek out medical professional advice if there are concerns. And if you're not satisfied with what you're hearing, continue to be an advocate for yourself.
Yeah. And stay on top of your health, right? I feel like that's the one thing I wish I had done even earlier is just know what's
Hmm.
going on with your body. And I feel like so many women don't know what's going on with their body and they're either they don't think anything is going to happen to them or they don't want to necessarily make those doctor's appointments because they're busy
Hmm.
and they're bit yeah, so I think that that's great advice.
Yeah, you're absolutely right. Fertility is one of those things that the it decays over time. So timing is very important. And so what you can do to potentially mitigate those things is maintain optimal health, although it's kind of difficult in the modern world with everything that we have and all of the conflicting priorities that we have. But a whole food diet, an exercise regimen, avoiding of tobacco products, minimizing alcohol use, all things that ultimately should, if you need intervention, will improve the effectiveness of that intervention. But hopefully that's not the case and you don't need intervention, will make your pregnancy healthier as well.
Sure. Well, you must see, I mean, how many patients a month? In the hundreds?
Yeah, we're getting up to almost, yeah, in the hundreds, if not a thousand.
Wow. Well, what is the biggest overall concern or worry that your patients are sharing with you when it comes to fertility and using telehealth and at-home testing? And how do you kind of ease
Hmm.
uh, those anxieties?
Well, we don't really see too much concern or dissatisfaction with the telehealth platform. I think uh, people have adapted to it and I feel very comfortable because in their professional lives and personal lives, the vast majority of people spend a lot of time in front of a screen. So all they do is just um, yeah, exactly. And so the addition of medical care to that repertoire at this point is probably second nature. And so we don't see a lot of concerns specifically getting their care delivered this way. There's, people are concerned about the potential of the accuracy of the at-home testing. There's some concerns about the survival of the sperm with regards to at-home collection. But for the most part, people are very accepting of this process and are very willing to proceed with telehealth and at-home testing if that's what we recommend.
Yeah. And on our end, I mean, we've had some very prominent doctors use our at-home test kits on
Hmm.
the same day that they, did a blood draw at
Hmm.
Quest Lab, and they matched
Hmm.
exactly, which I think is a big testament to the accuracy of at-home
Hmm.
testing. How can the results of an at-home test be integrated into a fertility evaluation by someone like yourself, a medical professional? And
Hmm.
what should you do if you get less than ideal results?
Well, it depends on what we're testing for. Obviously, in order for any pregnancy to occur, whether it's spontaneous or whether it's with any medical intervention, there has to be a healthy egg reserve. There has to be a healthy ovulated egg or retrieved egg. There has to be enough moving healthy sperm to get to the egg. And there has to be normal anatomy to facilitate that fertilization and then the transition of the embryo into the uterus and implantation. So, at this point, the tests that we have primarily account for the health of the cohort or the group of eggs, and then whether or not ovulation is occurring, and then whether or not there is a normal viability and amount of sperm. So depending on the abnormality that we find, that's how we direct the additional steps.
Hmm. You mentioned, the health of the ovarian reserve. What can somebody do, or is there anything you can do to sort of preserve your ovarian reserve for a
Mhm.
longer amount of time? Or
Well, that's a great question, and there's a lot of people working on that at this point. To try to improve our reproductive longevity, especially for women. And we don't really have a clear answer on that at this point, but we do know that a healthy lifestyle, specifically that's low in endocrine or ovarian endocrine disruptors or um, ovarian toxins, can certainly be beneficial. We always say the avoidance of a lot of processed foods, endocrine disruptors, any kind of overexposure to free radicals is probably beneficial. Unfortunately, it's not always practical to live your life that way because a lot of those, chemicals and exposures are essentially ubiquitous in modern life. So do as much as you can. However, the most of those variables are predetermined through genetics, or we call epigenetics, how the genes are then expressed. You can modify a little bit the second component, but the first component at this point, we can't really modify, or we don't know how to adjust it too well at this point. So, in summary, I think a healthy lifestyle that mitigates a lot of the modern um, issues is probably the best advice I can give you at this point. And if somebody is, you know, not ready for a family but desires a family in the future, asking a medical professional or a reproductive endocrinologist about fertility preservation is certainly an option.
yeah, and I think that's why it's so huge to test those hormones early, because you also get an idea of potentially what your ovarian reserve looks like. Not really if they're
Hmm.
healthy, but what it
Hmm.
potentially looks like. I feel like, and I feel like you touched on this at the beginning, that the medical industry is in some ways declining. People without
Hmm.
insurance are being charged thousands of dollars for basic testing. I went to a Quest not too long ago just for observational purposes, and people were
Hmm.
walking out being like, I can't afford $900 in testing. Um, and it kind of depressed me in a lot of ways.
Hmm.
And then you look at the price tag of IVF in the United States, and it deters people from even thinking that that's an option that they could move forward with. What do you have to say about the direction the medical world is headed?
Well, being part of the medical world, I'm hopeful that the medical world is heading in the right direction. Certainly, everything that you've observed and mentioned are issues that we're trying to work through on a societal level, as a country, as different states and municipalities, as companies providing healthcare services. Certainly, seeing those problems was one of the reasons why we started Fertility Cloud. It sounds like that's maybe a reason why you started Novolin as well, is because to us, it was unacceptable that economics put reproduction um, out of reach for
So
a lot
many.
of families and a lot of women. Exactly. And so hopefully for every problem out there like that, there's physicians and entrepreneurs like yourself that are able to step into that breach and solve those problems, and to, whether it's reproductive care or any other field, to help people get the care that they deserve.
Well, you are so wonderful. I'm so grateful for your time and your wisdom. Is there anything else that you wanted to add before we wrap this up, or anything that you feel like you wanted to touch on?
Well, I really want to extend my gratitude to allow me to come speak with you, and I hope this is a fruitful endeavor for both of us.
Yeah, me too. And that it helps a lot of people.
Absolutely.
That messaging, we just got to get it out there. I think that's the biggest thing.
Hmm. Absolutely. Absolutely. Thank you so much.
Thank you so much.